very good morning to one and all. This is Alisa, first year resident, going to talk about role of ectoine eye drops as an adjuvant in vernal keratoconjunctivitis, A New Hope. I do not have any financial interest to disclose. VKC is basically a bilateral atopic condition of the external ocular surface, mainly IgE mediated. There are several challenges while treating VKC. One such is the dry eye syndrome, which I'm going to talk about. Dry eye still remains an underdiagnosed complication of VKC, which compromises with the quality of life of these young minds. Here comes the role of a tear stabilizer and a noble molecule like ectoine, which is an extremolyte, which stabilizes the lipid layer of tear and hence prevents excessive evaporation of the tears. So my aim was to compare the result of loteprednol plus ectoine eye drops versus lote alone in the treatment of moderate to severe VKC. It was a tertiary-based prospective study in the spring months of March to May. Newly diagnosed cases of moderate to severe VKC with age more than 5 and less than 16 were included. Patients with any other stage of other ocular inflammatory disease, one-eyed patients, patients with history of surgery, trauma, and history of medications, and contact lens users were excluded. After taking informed consent, 40 children were grouped into two groups, with Group A receiving loteprednol with ectoine in the mentioned doses, and Group B was lote alone. We have followed up the patient with before the starting of the treatment, a week later and a month later, on total subjective symptom scores and total objective ocular sign score. TBUT and modified Bonini were degraded at the beginning and the end of the treatment. Tolerability in terms of history were taken at each visit and data was analyzed. These were the 5 symptoms, the 5 major, which were scored and graded from 0 to 3, 0 being the lowest and 3 being the highest. These are the 5 main signs that has been graded from again 0 to 3. These are some of the signs that I could find in my patients. Now coming to modified Bonini grading as such, where 0 refers to absence of symptoms and 4 is complete symptoms and signs. Coming to results, as you can see in both the groups, the age and the gender are matched, and Group A and Group B both have a male preponderance. In coming to symptoms again, over 0, 1, 2, and 3, week 0, 1, and 4, there has been a decrease in mean score of both the groups. By the end of 4th week, there has been a significant decrease in mean score of the symptoms, and it has come down from 8 to 1. The single most common symptom found was foreign body sensation followed by photophobia. In signs again, there has been a decrease over the 4 weeks and it has been significant. However, the symptoms have decreased more than the signs, and the most common sign was conjunctival hyperemia. In modified Bonini grading, as you can see, in Group A, because of a tear stabilizer that we had given, that 2 people could come down to symptom-free stage, and no such finding was seen in Group B. Coming to TBUT, there was encouraging results where in Group A, 12 people could come down to less than 10 mm to 2 people, and in Group B, it was 11 to 4. So summarizing my results, VKC was found more in males in both the groups consistent with the literature reviews. Foreign body sensation was the most common symptom. Conjunctival hyperemia was the most common sign. Both symptoms and sign improved statistically significantly in both the groups. However, symptoms mean score came down to 1 and was more significant. While taking history, tolerability in Group A was much better and encouraged them to take the treatment and accept it better. There was better result in improving TBUT levels, that was 80% versus 63%. And in the first group, like I mentioned, 10% of them could be symptom-free. Coming to conclusion, VKC has been a long-term burden since a long time on the society. So my effort was to include such a novel compound like ectoine, which can represent as a viable alternative or an add-on treatment to the standard treatment given and combat the challenges of dry eye and help with the burden. These were my limitations, that the sample size was small and there was a lack. We could have followed up the patients a little further. These are my references. I'd like to conclude. Thank you.
When was this ectoine discovered?
So it was around 3 years back. Like it started off with.
It was way back in 1985.
Oh,
so Jelinski and et al. Actually they have in.
How long you have followed the case?
Ma'am, for 1 month.
1 month.
4 weeks.
So what are the long-term complications of steroids?
Increase in there could be increase in IOP, and there could be cataract issues, could be steroid-reduced like glaucoma.
Only glaucoma?
With lote, there are chances. Cataract also can happen.
What type of cataracts?
Like posterior or subfracture.
So how long it take to develop secondary glaucoma or steroid-induced glaucoma or cataract?
It was around, like in the studies, they said with lote, the increase in IOP could come up after 55 days of use, and cataract it took longer, like over
What
6 months.
measures we have to take to prevent those complications while treating the patients with steroids?
We could first give them in taper doses, and then we could ask them to come for regular checkup with IOP, increasing IOP if there is a increase in IOP. Because I followed it for.
You included loteprednol in both groups. How would you say this effect is due to only this drug? Already steroid effect is there, na? How would you say?
Ma'am, my study was to show that we cannot replace lote. I'm not trying to replace the standard treatment. I'm just using it as an adjuvant so that the symptom part of the VKC that we do not focus on, the subjective improvement of symptom could happen because if we give a tear stabilizer.
It's like a only tear substitute.
It is, yeah. My point is to add it as a adjuvant so that the like symptom per se, which is a very difficult thing to deal with, comes down.
How it is better than other tear supplements?
Ma'am, the ectoine one, which was when it was taken up, as such in India there hasn't been only monotherapy of ectoine, so I couldn't use only ectoine drops per se in India. That hasn't been marketed. So if at all it comes, I can take up this study further.
Thank you.